We're going to get started now.
Ariel in here today.
All right, good evening, everyone. I'd like to welcome you to the Audit and Finance Committee, session number 3 on the 2023 budget. This is part 2 of the Human Services Agencies and department heads. You will be asked a series of questions related to your budget and are expected to answer as completely as you can. If any answers to your questions cannot be provided at this time, then please indicate when you're able to provide them to the committee. Legislators have been provided written responses to your budget information request letter. We want to thank you for your cooperation in providing them. However, in order to complete a more thorough examination of your budget, it may be necessary to forward you some additional questions after tonight's hearing. For example, there may be some budgetary or spending trend questions not asked at this session, but will be forwarded directly to your department staff by staff for a response. All right, we'll begin tonight in the order of that we will be taking the different agencies. We're going to begin with aging, then mental health, and then the nursing home. So Commissioner Debretano, you're up. And for our members, page 67 is where you'll find the budget information for aging.
Good evening, Madam Chair and legislators all who are here tonight. Thank you for the opportunity to present the budget for the Albany County Department for Aging. Thank you to the county exec, Dan McCoy, to our Department of Management and Budget, to the legislature, and for always supporting our efforts generously with your time and funding.
Ms. Rutano,
And yes,
I would like you to just hold on one moment, please. We know who you are. I would like the majority council to take attendance now.
Sorry.
We're ready to get started.
Sure, Madam Chairwoman. Ms. Willingham. Peter.
Here.
Bergdorf.
Here.
Clay.
Here.
Grimm.
Here.
Ray Joyce.
Here.
Lakakis.
Here.
Mayo.
Here.
And Brewski is excused. 8 present, Madam Chairwoman.
All right, the rest of our members that are here tonight, please announce who you are, and also if you're a committee chair, your committee that you're chairing. Thank you very much. We'll start on my left here, going down.
Carolyn McLaughlin, Chair of the Elder Care Committee, District 1.
Frank Canisso.
Matt Miller.
Gillies here.
Sean Ward.
Peter Tunney.
Andrew Joyce, District 9 Chair of the Legislature. Frank Moriello.
And the minority leader. Thank you very much. All right, you may proceed.
thank you. All right, as you all know, I always start off this way. As you know, the great Martin Luther King said, a budget is a moral document because budgets reveal priorities and values, demonstrates the way we as a society care for one another. As a commissioner, I enter into contracts, I hope, with that same quality of morality. We presented a relatively modest budget given the understanding that federal funds earmarked for pandemic services will not be as generous in the coming year. We are finally seeing a full return to participation in congregate meals. Important to note, 98% of our food contractors are minority managed. In fact, we now have 22 congregate sites, having added 2 in New Scotland and 1 in Furbush, previously unserved areas of the county. That's now produced approximately an additional 105 people receiving congregate meals. After a roller coaster ride with home-delivered meals, we are now leveling off. Because of a rule shift by New York State when congregate meals closed down due to the pandemic, there was a surge in home-delivered meals. People were admitted to the program without assessments. This year, we've reverted back to the entry requirements. Home-delivered meals and congregate meals are returning to pre-pandemic numbers. Our ISEP, at first glance, would appear that our participation is unchanged. But a deeper insight would reveal that it has triggered an increase in case management. The home care crisis continues to loom over the in-home needs of older adults across the nation, and our state director is working with the Association of Healthcare Providers to support funding and the training of aides to fill these positions. Our AAA association is lobbying successfully to increase funding in each state budget year to address unmet needs, particularly for our ISEP program. That increased funding does not require a county share. The AAA will go back this year to ask for more money for unmet need. We know that there are more than 400 unfilled hours, but also know that that could quickly change. These hours will continue to rise as people want to age in place, but the burden of this should fall to the state. Our SNAP benefits program has shown an increase in the county. 41% of those benefits are being received by minority communities. Of those receiving benefits, 51% are women. We've seen an incredible rise in the heap of applicants. In just the Bern-Knox area, there has been a 35% increase. Our older adults are worried over predicted increases in home heating this year. Seniors who are eligible for SNAP or HEAP automatically have access to the Affordable Connectivity Program. This federal program helps many low-income households pay for broadband service and internet-connected devices, and will be part of our outreach efforts to benefit our seniors. We hope to increase participation in the SNAP program this year and have applied for a grant with the National Council on Aging to meet that challenge. SNAP is critical because we have approximately 2,500 folks below the poverty line and not currently receiving SNAP. Our hope is that the new senior outreach van will enable us to go directly where seniors are to help them sign up for benefits and let seniors know what is available to them. Our HICAP program continues to be very busy. Open enrollment always brings in questions about Medicare, Social Security, and secondary insurance. The Medicare Savings Plan resulted in approximately $27,710 federal dollars going back into the county constituents' pockets. Our outreach and enrollment in MIPA resulted in those applications for Medicare Part B premium relief. That's $170 each month, along with extra help for drug costs. Getting money back into the pockets of the older adults is something my office and the legislature can partner on. That one call for one service often leads to other money-saving programs. And wait, there's still more good news. Albany County Department for Aging sponsored 2 Sage Table events that were very well attended. This year we changed the type of program offered to our LGBT community. We had a great response. With newly signed legislation by the governor, the Older Americans Act phrase, greatest social needs strengthens services by considerations of barriers of isolation caused by racial and ethnic status, sexual orientation, gender identity or expression, and HIV status. And as we continue to fight racism and prejudice issues, near and dear to boomers, we hosted a program entitled Deeper Than Skin. It was a combo of a workshop and a concert by renowned folk singers and activists Reggie Harris and Greg Greenway. We had an excellent turnout, but it didn't end there. This model, developed by the Office for Aging, is being shared with other county offices for aging and others in the aging field at the ACUU conference in June, so they can replicate this innovative programming to address racism that was started right here at Albany County. It's a win for other counties, it's a win for NYSOFA, and it's a big win for Albany County, as we are recognized as champions against racism. We distributed over 1,000 Stop the Flu bags across the county. Our seniors love the bags and reminder to get their flu shots and their COVID booster. This agency is committed to collaboration in the community. We're delighted to work with Senior Hope who works with seniors that are struggling with alcohol and opiate addiction. Our funding is helping older adults with the self-discovery process, encompassing the mind, the body, and the spirit, and is aimed at restoring the person's self-esteem, self-worth, and dignity. Saturday, I went to a listening session in the South End relative to elder care, sponsored by Statewide Senior Action Council and the Poor People's Campaign, A Village, and the African American Clergy for Empowerment at the Sentence Center for Law and Justice. It was a listening session. We also have 2 public hearings that are scheduled early in December in Cohoes and Ravenna. These are learning opportunities. Our restaurant program, we hope, will be started by the spring. We're still trying to get restaurants to sign on because since the pandemic, people are a little shy about getting involved in that again. But we think that we're up to 6 restaurants now, so we think that we're going to be able to launch it by spring. And we hope by then we'll also have a student from the College of St. Rose working with us. In our effort to meet seniors where they are, literally, we have purchased a van, thanks to our legislature approval, that will be retrofitted with an office. That van will give us the ability to hit the neighborhoods, senior housing, the hill towns, individual homes where seniors need help with processing paperwork, farmers markets, faith community parking lots, and diners, where you can always find some seniors. This van will be a huge plus for the work we do. We are the only county in the state to have this type of effort for older adults. Thank you to the county exec, thank you to all of you, to our management and budget team for your generosity, your wisdom, and dedication to Albany County's senior population.
Thank you very much for your presentation. I would right now entertain questions. I do have the chair of the Elder Care Committee. She has any questions right now.
Thank you, Commissioner. I know for the past year, it's been, a privilege to work with you and your staff to try to stay abreast of what's been going on through your Department of Aging. I will, at the onset, be accountable for myself, but in that, a lot of the things that you mentioned, I didn't know about that went on. I take full responsibility, even though I don't know how I could know about them if I didn't know about them. So going forward, I would just like there to be more communication about the activities that you're doing so that the Elder Care Committee can be more involved and maybe offer suggestions and just be able to provide information to the legislature as to what kind of things are out there that are being done so that they can advance that information throughout the county. Because some of the things seems to be just in certain areas. I know you talked about the numbers where the meals are, so many meals go to minority communities and that thing, but some of the other activities are of concern to me. The educational opportunities are of concern to me as it relates to giving information to elders, to our senior population. So in that vein, I don't know what the SAGE program is, and if I'm sounding like I don't know what I'm doing by asking that, I'm just saying I don't know. So if anybody else knows what it is, what is the SAGE
The
program?
SAGE program was, you had it all set up long before I showed up on the scene. It's for LGBT community, and the way it was structured previously wasn't working out so well. You weren't getting a good number of people coming in. It was a combination of younger LGBT people with older LGBT people. The problem was the younger people didn't know what the problem was with the older people, because the older people has kind of blazed the way, as it often is in these situations, and the young people didn't see where there would be a problem. So we kind of changed, we held a SAGE table, and we instead we picked a topic, not that was so LGBT only would be interested, but something that everybody would be interested in to bring people in. And that's what brought them in, and we did that twice.
Where do they take place?
We did one at Martell's. The ones previously, I think, I can't remember, I only went to one when I first came on board that had been done, and that was at the University Club. But we had one over the summer at Martell's, and the other one we did at Wolford's Roost.
Okay, I'd like to suggest that in our own voices, are they involved
They were
in that
there.
at all? And then the Pride Agenda?
They were there.
They're involved in that?
Yep,
I guess, okay, again, just in terms of education, because I didn't know, as chair of the Elder Committee, and my members, I'm sure some of them would like to be in attendance at some of these to show that we're interested. The other question I had, now you talked about that 98% of your home delivered and/or congregate meals were minority managed.
yes,
What does that mean?
that means that 98% of them are women,
Yeah.
because women are considered a minority.
Okay, that's why I had to clear that up, because you're talking about women, and when minority and women, when we see, a lot of us around the table, when we hear that word, we think of people of color, but it also includes women. We know that, but I think it needs to be clarified. So mainly you're talking about women.
Yeah,
Okay, just to be clear. And you did say that the restaurant program will probably come back online in the spring.
probably
And
in
at this
the
point, you
spring.
have about 6
I don't think it'll
restaurants.
launch well in
the
the
winter.
dead of winter.
How many did you have when it launched pre-COVID?
Well, we had 11 restaurants,
Mhm.
and we had, oh my God, I can't even remember, well over 1,000 people. We were rotating people through, so that we could get as many people to have the experience as possible. And do I think we can do that this time? No, I don't have the money to do that this time.
Yeah, and on the front end of that, I'd like to be able to help with the outreach on that, because when the original program launched, by the time it reached some of the inner city people, there were very limited slots available. And we sort of like had to come up in the rear. And I don't want to see that happen again. I'd like not to see it. So if we can help on the front end in terms of helping you launch it, and maybe even in helping to identify restaurants.
Well, I know that the Chapman Center is very interested, the women there have spoken to me about making sure that when the restaurant program launches, that they would be involved in that. So we certainly will reach out to countywide, because that's what we need to do, but we certainly will get it launched through the channels.
And, see, communication is key. And to me, I have felt like there's been, I mean, we work very well one-on-one with getting information and assistance to individuals. And I so appreciate that, because I've been able to address needs, just in time to get people situated in different places. Between you and the nursing home, Mr. Slatke, and I couldn't be more appreciative of that. But just in terms of what is going on in Albany County for our elders, because we have to be greater advocates for our elders. We cannot have them be an afterthought. I feel like I should be at that end of the table. But anyhow, but that's just how I feel. There's quite a few of us around this table in the category of an elder, those who will own up to it. But I really just want us to communicate more so that each legislator has the information that's available to them to give to their constituents. Because we don't want anybody missing out on anything that they have earned the right to receive. With the information and the thrust out there for trying to do away with Social Security and do away with Medicare, we cannot afford not to have the right information flowing throughout this county. And so I'm just committed to working closely with you as chair of this committee. So I look forward to that. Madam Chairman, I appreciate the opportunity to share this moment.
Thank you.
After the committee, yeah, I'd like to ask a few questions.
Okay, I got this. Can I ask a question first?
You're in charge.
I can't answer that. It's above my pay grade.
All right.
We could vote.
All right, so back to some of the issues that were raised by the chairperson of the Elder Care Committee. I started the Elder Care Committee because I felt that it was a group of people that were very underserved as far as advocacy in Albany County. And not just Albany County. I travel around, I've been to NISAC, I've been to NACO, and services for elders is not something that makes up one specific committee where there is resources that are devoted to advocacy on the Hill, whether we're in Washington or whether we are right here in New York State. Again, I listened to the various places that you brought up where you went, here and there. And when I think about, I understand that you said the Chapman program, there's, the only term I can use is, black people are not a monolithic society, where they're all just one place. They're all thinking the same way, okay? You continue to use that, and just as, I'm not a member of Kindred Spirits, so I don't know what you're doing. And I don't know about a lot of the programs. Listen to what I'm saying, I just want to get this across. The services that are being provided by the Department of Aging for Albany County, I just don't feel it's being, it's not out there the way that it should be. When I worked for the state, I worked for the retirement system, and I was a program administrator. But I also was the one that created the programs as far as the educational programs for retirement. And part of that included the New York State Department of Aging. And they became a real resource and asset to the retirement process. And so I'm really concerned because right now I have some issues myself. And I hate to say, I'm lacking in resources as far as I'm concerned, and Albany County is concerned, as my children ask me, well, you're over there, don't you have an aging department? You need to talk to somebody and find out what kind of resources that, we can get. And I just have to bring that out, okay? Everybody's not sitting in one spot.
Well, let me respond to that, please. Congregate meals, because we do get statistics, when people will get them, we need to have people get the statistics. When people sign in. This year, we've had 15,026 meals that went just to the African-American community. That's not, that wouldn't be one day a week at Chapman. So people are being responded to throughout the city and out in the hill towns.
Did you say the 15,000? That's
15,026 meals.
To
around the county.
Around the county, okay. Thank you.
For home-delivered meals for African Americans, we are delivering 19,832 meals. So the statistics show otherwise. I mean, we certainly don't think Chapman Center is it. That's not the only place that we're going.
Okay, so how do people get signed up for home delivery and congregate?
You go through New York Connects, it's a process.
New York Connect, so how
You
many
go through New
providers
York
do you
Connects
have?
and then
How
there's
many- How many
assessment.
providers do you have?
I'm sorry?
How many providers do you have that do the congregate meals? And how many providers do you have for home delivery?
Home-delivered meals, we have 3 providers. And, 4 providers, right. And then on congregate meals, we have 6. 6.
And, okay, so now I understand here the home delivery, it was 2.2 million in 2022, and for 2023 it's 1.7 million. Is that correct?
Yes, we didn't have it. What do you mean?
Yes, that is correct.
Is that what you got? Yeah,
And so-
okay, all right, yes.
Okay, so for the home delivery, you said that there were African Americans, 19,000. I really just want the total number of people served in each one of those programs, okay? And I also, you said there's 4 providers. So those 4 providers, what's the average amount of money? Well, if you could tell me, how much money? And how is this divided up? Is it by region or?
There are zones for home delivered meals. We would have to send you that if you wanted to look at what that, if you wanted to look at that. The registration, the statewide database, PeerPlace, doesn't permit us to do a search so that we can do it by zip code, if that's what you're looking for. But they're gonna use a different database soon, I think. And then, we might be able to drill that down in a different way. But I'm happy to send you any of those numbers. If you, email me what it is that you want, we'll send it back to you.
Well, the one thing I do want, I want to know how much money each provider gets, and how many people they're serving, and where they are
We
serving.
can send that to you.
Okay.
We can send that to you.
Please do the same thing for the congregate meals too.
We can do
The
it
6
for all, of them,
providers.
yeah.
And where they're serving, and how many they serve.
Yes,
So,
well, if you have this book, and I would assume that everybody does, if you don't, I would question why, would list all the places that we go for congregate meals, would be listed in here, except for the 3 new ones that we have, that were previously unserved areas.
oh, you're talking about the sites, right?
Sites,
right
isn't
now.
that what you're talking about?
Mhm. I'm talking about the actual providers as far as,
You want to know where the providers are located?
I want to know who they are and who they serve. You said it's broken up into zones, is that correct?
Broken up into zones, yeah.
Okay, so, pick
So
one.
LifePath is one of our home-delivered meal providers.
Right, and so they do home delivery. So how much is their
They also
contract?
have congregate meals, but they do home-delivered meals.
Oh, so they have both congregate and home delivery. And so how much is their contract for home delivery?
Oh, right here.
For home delivery.
Life plan for next year, 700
And for next year, $758,041
for each year,
for 8 home-delivered meals.
and 300.
And $310,000 for congregate meals. Now, they do the bulk of the congregate meals, and they do the bulk of the, well, no, I guess Peter Young maybe does the bulk. Peter Young is another home-delivered meal provider, not a congregate meal site.
Yeah, that's.
No, and they're less. They're getting $414,044.
Okay, can you give that to me in a report?
Yeah,
Okay, I would appreciate that greatly.
yeah.
And so, are these contracts on a yearly basis? Just
Yearly,
annually?
we send out an RFP yearly, so anybody who wants to offer to be part of it gets an opportunity to send in an RFP.
All right. Mr. Bergdorf?
Thank you very much, Madam Chairwoman. I think everybody needs to recognize that the Department of Aging is basically a pass-through service. They've got 10 employees, okay? We're used to looking at social services with 300, children, youth, and families with mid-200s or whatever. But when I see, the transportation number remain the same at 630,000, the caregiver number remain the same at 191,000. The daycare number went down from 39,000 to 31,000. I'm not sure why that's the case. But I picked up right away that congregate meals were down 300,000. And you said that was cutting down, but the home delivered meals were up. I see the home delivered meals down another 400,000 as well in terms of expenditures. So I have sort of the same questions. Are they down for some sort of economic trend, or are they down because we are not promoting them appropriately? And while I understand everybody around this table has a different vision of how they could be promoted in their geographic area, we have as many seniors in Colony that also need the services. So I want to make sure that your services are promoted as well in our town. So why is congregate meals down so drastically? Is that because federal money is
Yes.
down?
It's stimulus money.
And so does that mean that there are people who used to have the service that are now not getting it?
Not that we know of.
Well, how could you be down $300,000
Because we
for
don't have the money
congregate
to put
meals?
towards it.
Excuse me?
We don't have the money to put towards it. And you got to remember, COVID was part of it. So off and on, the
She's saying the
congregants-
demand is less.
Can I jump in for a second? Because
You can
you had
jump in.
you had a statement in your opening remarks.
Yeah.
Where you spoke to, during COVID, there were no standards on who could get the services and
Right.
who could not. Those standards are now back into place, the income levels.
Okay, so there are people who are above standard.
Who got
Who are
services
now
during
no
COVID
longer
because that was
eligible.
suspended, correct?
Okay. So I don't know what the standards are. That's probably a discussion for a different day. Is it the same case?
Is it only for home delivery?
Oh, what happened was.
Is it the same case for home delivered meals? Let me get that out.
Hang on a minute.
Yep.
Home delivered meals, the reason why that increased was because the congregate meals closed because of COVID. So those people were automatically offered the opportunity to get a home delivered meal without an assessment. That's a big part of it, without an assessment. Once it reverted back and you had to go back through the regular procedure, your case management went up because now people were getting assessed, which was now triggering the case management. But it was less people because they weren't eligible anymore for a home delivered meal. That's why when we said congregate meals are now the numbers are returning to pre-pandemic levels, that's what they're doing. Anybody in Albany County can go to any congregate meal. Here in Albany County, or Schenectady County, or Saratoga, they can go anywhere. And that county would pay for it, because that's the way it is according to the Older Americans Act.
But home delivered meals went down too. It went from 2,234,000 to 1,763,000.
Because then those people who weren't assessed properly, who were getting home delivered, now had to get off the program because they weren't eligible anymore. You have to be frail, you have to be homebound. There are a lot of things that gets you a home delivered meal. All of that was taken away during COVID. during
Many of
the-
us were told in the past that there were no limits on home care or congregate care, or maybe that was just in fact, they didn't turn anybody away.
I don't know what you're talking about, home care.
I mean, not home care, home delivered meals. But, okay, so
Nobody was turned away during COVID.
even before that. So the downturn in these two programs relates to changes in eligibility?
Yeah, go ahead.
So basically what happened, there are two factors. So if we are looking at the home delivered meals, right, the first factor was basically that people didn't need to do case management, go through case management anymore. So that brought the number of people that we served up. So we basically spent more money on home delivered meals. But at the same time, second factor was that we received the stimulus money from NYSOFA. So we were able to basically cover all these expenses. So that's what brought home delivered meals, the numbers up. In case of congregate basically meals, we also introduced, besides a regular congregate where people congregate basically and have a meal together, we introduced grab and go, where people can just stop by, grab the meal and go basically. And that also was a factor in bringing the numbers up for congregate. Because we are basically gradually right now, we phased out, and right now everything comes back to normal where we have regular congregate and we do not have a grab and go. So, the spike and the decrease is only basically dollar amounts, but we do serve the same amount of people. So those people that, for example, maybe were using HDM meals when there were no requirements, right? Right now they can go back to congregate meals basically. And we have less money because we spent a big chunk of stimulus money basically paying for home delivered meals and congregate meals. So, and in 2023, we basically we still have, they call it American Rescue Plan money. We have that money, but it's under $1 million basically. So that's why you see the decrease in funding basically.
What happens when you run out of those funds?
It's not going to happen. I don't think it's going to happen within 2 or 3 years. And then when that's going to happen, I mean, we will address it at that time because we don't.
At that point, we have a policy decision. Do we continue it at the increased county share or not? It's a decision we
Okay.
make together at that point.
Okay.
I'm gonna do this. This is
I got like
Wait,
two real
wait.
fast ones.
Okay, so Matt Peter has a question, Ray Joyce has a question, and Linda Cacus has a question, and also Mr. Grant. Okay, I'm putting that out there, so
Okay.
if I cut you off, I just want everybody to know, I want you all to get off.
Real fast. Where are the 6 restaurants that you have right now? Where are they located?
One's in Gilderland.
Geographically.
Pardon me?
Geographically, I'm not asking
One's in
you.
Gilderland, one's in Slingerland's area. Yeah, that's Slingerland's. So that's Gilderland.
If you can't tell us
You know,
now,
I
that's
can't
okay.
remember them offhand,
Okay.
We just provide
but
that.
they're all around, but
Well,
I.
that's what I want
But
to see.
they're all
I'd love
around, yeah.
for you to give that to the chairperson.
And we're trying to get more because we want to be able to make it go that much further.
Okay,
Yeah.
and I got one last question, and I think I know the answer to this. One of the things I'm not sure where the number is, but you have something in your budget for $18,000 for enhanced pay. And in your questionnaire that you sent in, you said nobody was getting over the 2%. Is that 18,000, 6 times, or is that COVID battle pay, or what is that 18 grand
Want me to jump in again?
for enhanced
Yes.
pay?
So as part of the evolution of some of these programs, Deb had originally requested a couple of increases to salary to specific employees that were handling those programs. We had some discussions back and forth with her, and basically, we're in a union negotiation like we got into yesterday.
Yep.
That is a portion for that to cover those as part of that settlement, whether it goes, whether a piece of it goes union, piece of it goes non-union, the specific hasn't been worked out, but that's what that's for.
So that 18,000 is going to be somehow distributed among the 10 employees in the department?
That's why it's listed as a personnel, non-individual line, yeah.
And so I just want to clear this up. That enhanced pay line is not only in the Department of Aging. That's across.
Correct.
All of them. So, and I would imagine it's being used the same way. And it's people working in out-of-title jobs.
There's a variety of ways it can be utilized, but yes, the number one is out of title or increased scope of their work.
Okay, so just so that we don't have to get into this again, take 1 minute to explain what the enhanced pay line is, because it's for everybody. It's for all the
Well,
agencies.
and there are slightly different permutations through some of the different departments, but as to your point, the main use is out of title work, enhanced scope to align. This was a big part of it was to give us some flexibility, so as we're rolling out a program, we may say this person's gonna be the point person on this program, those added responsibilities, they get compensated for a portion of that. But if it's a program that doesn't work out, does that necessarily mean that they get a permanent increase to their base? No, this is a trial in the enhanced year, and then if it's a success, we come back to you for the following year and put it into the base.
Okay.
Other ways that it's utilized are additional grant funding. The job tasks are tied specifically to a grant. So some of those grant monies will flow through the people that are satisfying the requirements of those grants. That was the earlier tradition, or more traditional use in the county among some of the separate electeds. We actually have another department that's up tonight where they have enhanced funding coming from New York State. Again, there's issues with the union negotiations right now. We don't want to play the cards on the table, but as you'll hear from the health department, they have additional state funding that has been put into an enhanced pay line. So it'll be pushed out as it's, when we're able to unveil that, it will come out.
Is this new?
Enhanced pay lines have been used in Albany County since before I was in charge.
Okay, thank you. And just so, if you would, just prepare something so that we can give it out to everyone so they do understand. And so I'm going to move to Mr. Peter, and then to Mr. Joyce, and then to Ms. Lakakis, and then to Mr. Ward, if he still has something he wants to say.
My question was answered, Madam
Oh.
Chair. Thank you.
Oh, I'm sorry, I didn't mean to leave you out.
That's okay.
Thank you, Commissioner Ratana. A couple quick questions for you. The first is, I know you have a limited staff, and I know some of them are union. Among your more senior staff, how do you, evaluate their performance on a year-to-year basis?
Well, substandard isn't allowed in my office, so I think I look at the results of our programs and how our programs are working. And that kind of dictates our what our accomplishments look like, kind of dictates what the senior staff, how I judge their work performance.
Okay. Madam Chair, if I could?
Yes.
For the restaurant program,
Yeah.
two questions on that. What is the revenue source for that? Is that specified in the budget?
The restaurant program, where are you at?
Oh, we're paying for the restaurant program through the fees for services.
The fee for services
Through
line?
fees for
Okay.
services.
Just a quick follow-up on that one, and then I have one other quick one. Have you reached out to the Restaurant Association of New York State to talk about potential restaurants that might be interested? The president of that for New York State actually owns a restaurant in Albany. I'm not saying he might want to participate, but he might be able to send it to his members to see who's interested.
This time, no, I didn't. We did last time, reached out to the Restaurant Association. We're not looking to unduly burden a restaurant, which did happen with the grant that we had. Because, restaurants really they really had to put in some of their own money to cover what we were doing, because we got slammed with so many people that we didn't expect. So could we go that way? Yes. There are restaurants that we're still waiting a call back on. I know there's one in Cohoes, Waterloo, the Purple, yeah, that we're waiting to hear from. Also, another one of those restaurants that we have on board is Bangkok. So, yeah, so that, yes, I mean, we can go that way, but if we can't support the funding,
Right.
and I only have a set amount of funding to be able to use, I don't know that would be I don't know that would be a good way to go.
Oh, no, I mean, you just mentioned you were looking for more restaurants.
But if you know some restaurants who might be interested in us, we'd like to talk to them.
Okay, and I guess finally, in your funding and presentation, things like that, is there any money for NORCs or helping to, sort of create and enhance existing or create new NORCs?
No, NORC funding comes from the state. It started with the federal government. I used to run the NORC. Matter of fact, I was the first director of the NORC. There are certain rules and regulations that go with the NORC. If somebody was to approach us, a not-for-profit, and say, we'd like to start a NORC in South End, let's say, there are rules that go with that. You can't have more than 2,000 people. You can't. Everybody has to be. It has to be 40% 60 or older, head of household. It can't be a building. It can't be a building NORC more than 3 stories. There are a whole lot of regulations that go with that. I think the NORC has worked out really well. I thought at one point it was going to lose its funding because I thought the state was going to give them up. But they have enough other backing that's able to help them to move on, to move on with, not expanding it, but meeting the people. But you got to remember, that was a help to help people age in place. The people that are living in that NORC area are selling off their houses or dying and being replaced by young people. So those stats that met the criteria back in 2005 when I was there might not hold on going forward, but it's a great walkable community.
Right, and I just meant like if there's other communities that's losing it, that might be considered and reapplied type of thing. But
They put an RFP out for the NORC before the pandemic for people to start a NORC. That didn't happen anywhere else here in Albany.
Okay, and I would like to say that would be something else that, I think we should have in the report, so that everyone understands what a naturally occurring
Retirement community?
is.
It's a neighborhood naturally occurring retirement community. It's not a NORC, NORC.
So we're going to move on to Mr. Joyce.
Thank you, Madam Chair. Commissioner Rottano, first off, thank you for everything you've done for the in-home vaccinations for a lot of our seniors in Albany County. It was a huge lift for a lot of folks that were afraid to go out in public more than anything. But just for clarification, I don't want to beat it to death, but we talked about the home-delivered meals and the congregate meals. And it looks like there's definitely, just after Paul's questions, I see some correlation. I heard stimulus money, but you have grants that you lost somewhere in the ballpark of 35% from 2022 to 2023 as far as congregate meal grants, home-delivered meal grants. And they correlate almost with the same reduction in budgets for both congregate. Am I reading this correctly? Is that why we lost?
Yes.
Okay, that was just clarification, that's all. That was it.
Okay,
Everything else was
Mr.
answered.
Mr. Cox.
I was wondering if our county has either the people are eligible for home delivered meals or they're not. Is there anything in between, like in Suffolk County, you could pay $6 for your meal to be delivered if you don't qualify, but you're older? Do we have anything like that or no?
Depends on, no, we don't have anything like that, but also it depends on a person's insurance. Because some people have an MLTC that, that they can get home delivered meals, but they're frozen and they're delivered to their door. So an insurance covers that. So that's more of a New York Connects issue.
Thanks.
But as far as paying for your meal, even in a congregate meal,
Yeah.
when we go to the congregate meals and we test drive, to see what's happening, we certainly all pay for our meal, even though I would be entitled to it. We all pay for the meal. And people who, people give it back in the contribution. But do we have anything in between that they could pay for a meal? No, we don't. And I'd have to talk to the Suffolk County Commissioner to see exactly what it is that they're doing that's making that happen.
Okay, thanks.
Sure.
Mr. Joyce.
Yeah, just one more question. This is more for Mr. Riley. We talked about that enhanced pay we're seeing across many line items in different departments. Is any of that for employees who were publicly facing employees that had to, give vaccines during the pandemic or had to go into homes or social services? Or is any of this like COVID award money for those folks that had to, work during the pandemic? Is this?
There will definitely be some of that overlaps that. There's not a direct correlation with that, though.
Okay, there should be, but.
Like I spoke to, as we'll speak to the health department in a little while.
Yep.
Virtually everyone in their department
Yep.
was hands-on in the pandemic.
No,
So
agreed.
obviously, there's a very large chunk right there.
All right, thanks.
All right, thank you. And we're winding this down now, so if I cut you off, Mr. Grimm, go ahead.
Okay, thank you, Madam Chair. In your memo to the committee on item 15, we talk about performance indicators. And you list that we report our data required by NSOFA to receive all state and federal funding. I do think there's some confusion among agency heads. This question is really about the value of the agency and what is the quantification that indicates those performances, rather than compliance, which of course is important to go comply with the law. But as I sift through here, I'm not finding a lot of practical outcomes. Now, there are some examples. We distributed 2,000 COVID test kits. That's a clear practical outcome. The questions I would have, for example, is how many seniors did we help in the last year? And then how did we help them? What specifically did we help?
Are you talking about across the board, including legal?
Your department, yeah. I mean, because ultimately that's your goal, is to help as many seniors as you can. And it's also helpful to know what was the basis of that help in terms of
I
quantification.
would. Could we put that in a memo to you, and then I can go through all the programs and then give that to you?
Yes, you may. We appreciate that very much.
Because, I mean, that's clarity, and we heard some issues of communication tonight, and clarity is really a powerful tool in communication.
Yeah.
If you can, because you work hard, I've seen you act in that. And, but if we can lay all these things, the things that really matter the most to me are how many seniors did we serve, and how did we serve them? And thirdly, what did they say about the service? And I wonder if you have any customer feedback.
We do.
That you can quantify.
Yeah, we do. We
You
do
can show that.
surveys.
Okay.
We do surveys throughout the county.
Because those are the kinds of things I'd like to see, frankly, from all agency heads.
Is
I
that
just want to
the,
clarify that.
did everyone get their ask in? I hope so. All right. I want to thank you for your presentation tonight. I know, there are a lot of questions, and, some things need to come out during the hearings. So,
Thank you very much. Thanks for inviting me. Invite me again.
all right. Are we going to move on? Mr. Giordano, you're up next.
Thank you.
Okay. Dr. Giordano, I'm sorry. And could you just introduce the people that you have with you too? And we'll
Good evening, Madam Chair. Thank you for the opportunity. I'm here tonight with Deputy Director Cindy Hoffman and Associate Director Michael Fitzgerald, and they are here to prop me up. Louder? Louder. Okay. With your permission, I would like to read a brief opening statement.
Yes.
I'm here tonight representing the Department of Mental Health to present the County Executive's 2023 budget for our department. I believe we at the Department of Mental Health have kept our promises to those in our community, those who have depended on us throughout the public health crisis of the last 3 years. And I am confident that this budget allows us to keep our promises to them moving forward. The Department of Mental Health has been fully operational throughout the course of this public health emergency. All of our services have continued to operate and serve the residents of Albany County, including our crisis services, our jail mental health services, our clinic services for mental health and addiction, and our community care management teams and our forensic services. During this time, I'm proud to say that we've even been able to innovate and expand some of our services, specifically, or as an example, in the areas of telemental health, alternative crisis response in the community, and overdose response, to name just a few. And we intend to continue to innovate and expand moving forward. Before I finish with my remarks, I would like to just briefly describe one of those programs, the MOTOR program, which I know some of you have expressed interest in. Our mission is to provide a safety net of services for individuals who are living with acute behavioral health illnesses. We do this not only through the services that we directly provide, and those are extensive, but also and importantly in partnership with over 20 community agencies who operate over 80 Office of Mental Health and Office of Addiction Service programs, for which the Department of Mental Health has fiduciary responsibility and oversight of what are 100% state aid funding contracts, and those are the ones that are identified in our budgets in 4320 and 4322. We don't do this by ourselves, but we do set the tone and the direction through our mandated local planning, our system oversight, and our leadership. Because of our successes over the years, New York State Office of Mental Health has identified our department as a vital piece in the Albany community. The last 3 years have taught us that we are vulnerable in ways that we could never have imagined, and we've learned that we are resilient in ways that we didn't know until we were tested. The men and women at the Department of Mental Health remain dedicated to the task at hand, and I believe that the county executive's proposed budget gives us the means to attain our goals and meet the community's expectations for us as we move forward. And if I could just take a moment to talk about the motor program as one of the examples of innovation, even in the midst of a community crisis. And I'm going to leave some materials for you afterwards as well. The motor program stands for Mobile Outreach, Treatment, and Overdose Response. It is staffed by 2 individuals in our department, certified alcohol substance abuse counselor, professional physician, as well as a certified recovery peer advocate, which is a paraprofessional or peer position. There are 2 aspects of this. First of all, it's a mobile initiative. It is attached to our licensed addiction clinic, and as such, we do mobile outreach and services for some of our patients. We appear at as many community education events as we can throughout the county. We provide in those visits fentanyl strips, Narcan kits, and anything else that might be required by the person who is requesting our services. Importantly, there's a second aspect to this which we hope to expand moving forward, and that's our overdose survivor response initiative that I've talked about at the Health Committee in the last year as well. This is a very innovative program. In my view, there's only one other county in the state that's doing this. We're working with, at this point, 2 local law enforcement agencies and the Crime Analysis Center in the Capital Region Crime Analysis Center, which is located in the city of Albany. We're working with Guilderland and Colony PD, and what we receive from those 3 entities are individuals who have survived overdose. We can talk a lot about those who have not, but we're interested in this program in reaching out to those who, through police reporting, this is not healthcare information, this is simply police reporting. We send our motor team out and we reach out and try to help those folks as best we can. What we've learned over the years is that we'll see an overdose at a certain location, we'll see an overdose a few months later at that location, and then sadly, but too often, we'll see a fatality at that same location. What we're trying to do is go to that location after the first overdose and before the fatality. And we're met with mixed response. Not everyone wants people knocking on their door. Not everyone answers the door. But we leave materials if they don't answer. And sometimes people answer the door and say, thank you for even knowing about my challenges. And we've responded to 123 post-overdose instances, and we have responded to 145 referrals for our outreach program. So this is something that Oneida County in the state of New York is also doing. They're working with their Crime Analysis Center as well. They're working with all of their police agencies. We're only working with 2. Watervliet and Bethlehem have expressed interest. And the City of Albany is doing something similar with Catholic Charities right now. But we hope to kind of weave all this together so that we can respond before someone dies. So that's the motor program. That's one of our innovative programs in the last year, and we hope to expand it in the coming year. And I'd be glad to answer any questions that you might have about anything else in the Department of Mental Health.
Thank you, Commissioner Giordano.
Yes, sir.
Got a couple for you, if it's okay. I guess to start with, how do you view, outside of your unionized employees and things like that, how do you view your department's senior staff as a success, and how do you view your programmatic success? Since especially given your program, you're not dealing with individuals who may be able to be cured, but it it's a continued response. So how do you view success?
Of the senior staff?
Of the senior staff or the development of the delivery of those programs?
Yeah. Well, let me talk about the senior staff issue first. There are 5 people on my senior staff. They are individuals who I meet with on a daily basis. We have senior staff meetings every week. I see them as my delegates or representatives. And although you could ask them, I suppose, whether they feel micromanaged, I hope they don't. But I take responsibility for everything that they do, and therefore I'm particularly interested in the quality of their work and the success of their work. It's kind of I wouldn't say informal evaluation process, but I know what they're doing moment to moment, at least I try to, and I feel like I'm on top of them. The program evaluations that's a much larger question, and I prefer to wait till Mr. Grimm asks me about that.
That's fair. And with that, I have 3 smaller, relatively easy questions and 1 really hard one, so decide which one's which, based on some of the questions we got from other members. One of the new projects you have coming up is the Suicide Prevention and Education Committee. Can you sort of explain that?
Well, that's not a new initiative. That is a partnership that started actually with the Department of Children, Youth, and Families and the Department of Mental Health. And then a few years ago, before COVID, the Department of Health joined us in this effort. And this is really recognizing that suicide is again, it's a public health crisis as well as a mental health matter. We have an ongoing committee and a task force of community experts and program representatives. And we're actually later this month meeting with New York State because we're hoping to initiate a program that has been successfully implemented elsewhere in the nation called Zero Suicide, which is a community-wide, stakeholder-supported initiative to reduce the numbers of suicides.
Great.
So it's a priority for us.
Great. On your budget, I think your medical supplies are doubling. Is that merely inflation or?
Yeah, we were just talking about that earlier. We went through that pretty much line by line, and the medical supply increase last year was almost entirely related to COVID supplies, cleaning products, masks, hazmat suits, et cetera.
Okay. And lead funding is also down substantially. Is that more to do with like grants going in different places, or what's going on with that?
Well, I don't know if everyone's familiar with the LEAD program, but the LEAD program is a program that's been in operation for a number of years. County got a grant a little while ago, and there's been another grant that's just come in, and so that LEAD funding will be increasing shortly. I don't know if anyone else has anything to say.
I suppose the final question is, one of the big things we talk about, and we talk quite a bit, Dr. Giordano, is where do you think the bottleneck is in the largest part of it? And I don't just mean, that's not like a county question, right? Because mental illness and mental health is a larger systematic issue. But where are you seeing the bottleneck, right? Where can't people get the care? Where are people you're trying to help can't get help? I just think we need to understand that, because I think a lot of people just assume a department can do something, and when it doesn't happen, it's just a simple thing.
Yeah. Well, it's a very important question, and I've thought about it quite a bit, and I've spoken on it quite a bit. What's interesting about, I think, our current times is that, those of us in the mental health field, we've been waving our arms and looking for attention nationally for forever, but suddenly we've become to the forefront of seemingly all the societal ills depend on successful mental health treatment. And although I welcome the attention, there are a lot of cooks in the kitchen now, and that complicates things a bit. But this is a long-standing challenge that goes back, and I don't want to bore you with this, but the deinstitutionalization movement in the '60s, where I think correctly people who are being institutionalized were brought back into the community. the money from the federal government never really followed those patients. And that's taken, over the decades, that's created a lot of challenges, resulted in part of the homelessness crisis. But I think lately in New York State, there has been a concerted effort year to year to shrink the state hospital system. And what that has resulted in is a bare bones of hospital opportunities for people who need it. The assumption is that everything can be done in the community. Everything can't be done in the community. What happens then is that our emergency rooms get, use your phrase, a bottleneck. There is an interface with the criminal justice system now that is particularly challenging to us. And, people used to get, unfortunately, because the hospital system was failing us, they would get arrested, and we have a very vibrant mental health program in our jail, sad to say. But now they're not even being sent to jail because of some other policy statewide decisions, which I'm not taking a position on tonight. But folks are not getting into the hospitals, and they're not getting into the jail, and they're not getting treatment. And I can tell you that my mobile crisis team calls me almost every day. And what's happened, what I thought was a particular challenge in Albany County, is happening at Albany Med, it's happening at Ellis Hospital in Schenectady, it's happening at Samaritan in Rensselaer County. And lastly, I'll just say, again, I don't want to belabor the fact, but this is a big issue for me. There are nights when every one of those hospitals has closed their doors to psychiatric patients. And we are doing crisis intervention on the street, sometimes with the police, most often not. And the bottleneck right now I see is in the hospital emergency rooms. So anything we could do to divert people from that bottleneck helps, but it's a very dire situation.
Thank you, Dr. G.
Thank you.
Yes, sir.
Mr. Ray Joyce, who is also Chair of the Health Committee.
Thank you, Madam Chair. Thank you, Dr. Giordano, for everything you've done over the past 2 years. I know your caseload is going up through the roof, not just so much through the pandemic, but afterwards, the post-pandemic stress that resulted in a lot of the issues we're facing now. But I don't like asking what, are you happy with your budget? Because in front of executive staff, everybody says yes. So what's the one thing we could do for you, if anything, that could help your department?
So if you allow me,
And then I'll follow up with Dr. Whelan on the same question in a little bit.
Legislator Peter asked me this question 4 years ago, and I answered at that time, if you gave me $1 million, I could spend it, but we're doing quite well with the money that we have, and I think the money is being spent effectively with good results, and we work very closely with management budget and the county exec's office, and I think this is a budget that reflects our needs.
Okay. And just a few quick questions. Just so I understand, and I think I've asked you this in the past, we have a methadone clinic, a regional methadone clinic in Albany. Two, right. So there's transportation involved in that, there's services, there's issues that arise locally because of those clinics. As people come in from other counties, who pays for that? Is it paid for by the county? Is it paid for the transportation? Albany County doesn't pay for, say, the transportation of someone from Saratoga County to Albany County.
No, absolutely not.
So is it state or is it the county of residency?
Well, your observation is correct. Whitney Young and Camino Nuevo are our methadone programs, and there are many hundreds of people that go there. These are state licensed and federally overseen, and they're regional. And we've heard the mayor speak on this quite a bit about why are they all ending up in Albany. I don't, off the top of my head, no, I think a lot of it's Medicaid.
I think it's Medicaid dollars for the most part that pays for the majority of that.
Okay, I was just curious if it has to impact your services, trying to care for the people of Albany County that are, say, living or working in those areas where, we see the overflow and the issues that stem from having these clinics in the city of Albany, but, we understand the need, but it's also a burden too for the host county.
I don't disagree with that. I don't have an answer.
Okay. Just then, two quick other questions. This graph kind of surprised me in the budget book about the correctional facility. The census, the treatments have gone up drastically, I mean, compared to the residents at the correctional facility.
Is that the data that I provided to you?
Yeah, it's in the
Yeah.
table here.
Oh, yes.
I just trying to understand what those treatments are. Is there some, I know the population is going down quite a bit, maybe a third, but the treatments have gone up quite a bit for that remaining population.
What I can tell you is that there are two crossing trends here. One is the census in the jail is plummeting. And the other is that the proportion of that census that is on the mental health tier is skyrocketing.
Okay, so that explains why.
It's a de facto psych hospital, when in fact, it's not set up for that. So but we're fully staffed up there with a team of social workers and psychiatry and nursing, and it's it's not 24/7, it's 7 days a week though. And I'm sorry, as loud as I can go right now.
It's okay.
But the treatments are the same treatments that you would get in our clinic downtown. They're intensive psychotherapy, they're medication management, crisis intervention, all of that.
Okay, and one remaining question, Madam Chair, if I could, and this is for Mr. Riley. I don't see an enhanced pay line for mental health. Should there be?
Well, as I said earlier, most of those enhanced pays are tied to other funding streams, not all, but.
Okay, I thought, all right. I thought mental health was included. Oh, I'll follow up after.
Okay, yeah, we can touch base.
Thank you very much. Ms. Bergdorf.
Thank you, Madam Chairwoman. Dr. Giordano, thank you for your presentation. In going through all these budgets, you can't help but notice the staffing problems that every department has. I did a quick count of your vacancies, and you had 24, including some very high-level vacancies. And then I saw 17 positions that are going to be reduced or refunded. I don't know what the overlap of that is with the vacant positions. But it would seem to me that you have some unique challenges to find the right people to go into these jobs. How's it going, and how are you doing it? I have a couple other questions after that.
You're absolutely correct. Put in perspective, this is coming to a head, I think, in the current weeks and months and this last year. But I will tell you that the number one challenge for all of our community partners in the behavioral health world, and I'm part of a statewide conference of mental health commissioners, this is the number one challenge that everyone is facing, at least in behavioral health. I know that there's elsewhere. I can only speak about behavioral health. Yeah, there are unique qualities that are required. Not everyone is cut out for the work. But what sadly is happening, I think, is not everyone is interested in the work any longer. And I'm not exactly sure why that is, although I think it might be related to my earlier comments about there's a burnout factor as a result of this intense crisis work that is becoming a part and parcel of every element of the system. So it's been very hard to find folks who are interested and then, of course, qualified. So the numbers that I have as of today are a little bit different. We have 21 vacancies, but of those 21 vacancies, 6 positions are offered, 1 has been filled, and 1 is being interviewed. So it leaves us with 13, still way too many, but it's not as grim as you had just mentioned.
You have to speak up, please.
Yes, ma'am, I'm sorry. It's not as bad as you mentioned, but it is still very challenging for us. Again, what we do is, we're the safety net for, as I said, acute and chronic behavioral health problems. The folks we see are, everyone has something. The folks we see have a lot. And we we have to provide for them. So what happens at the jail, for example, if one person leaves for whatever reason, the burden on the rest of them on staff go up. If 2 people leave, the burden on the rest of them go up. Our mobile crisis team has been challenged this way, our jail staff has been challenged this way, and the folks that you see with me tonight, this is a daily attempt to stop the spiral. So we're always advertising, we're trying to incentivize some of the things we did in our budget to increase retention and recruitment, but it's a daily challenge. Your observations are absolutely correct.
Second questions. You commented on the lead funding, but I took a look at your contractual expenses and by broken down. I mean, narcotic addiction is going from $8,085,000 to $8,719,000. Virtually every one of the contractees are going up. Is that based on contracts that we have in place that have escalation clauses, or is it based on a projected increased census for that?
Well, actually, maybe a little bit of both, but there's a third factor that's even more important. And when I come to the Health Committee every month, each year, actually I didn't make it this last month because I was ill, but I bring to you all of these contracts for annual renewal. And you've all taught me to start with, this is 100% state funding. We're pass-through on this.
Yeah.
And we monitor and oversee that system of care, but those contracts are totally dictated by the federal government, the state government for OASIS and OMH. There's 20 or 21 programs, 80 programs, 20 agencies, 80 programs, but we don't have anything to do with that funding.
Okay.
And it's the same, by the way, Mr. Bergdorf, in every county in the state. That's the way they funnel their money out.
So they give you a number right down to the dollar that you should be requesting.
Yes, and all year long they modify it, and I come before you again to ask for more, but it's
Hey,
always,
more grant money came through.
right, but it's always 100% state.
And what happened to the lead funding again, where it went from 663 to 60,000?
Well, I don't know if anyone else wants to take a shot at this, but the lead.
Maybe I can take a stab at this one. You guys don't mind. So,
I would love that.
in 2020, this legislative body authorized the acceptance of a 3-year grant that was awarded to Albany County on behalf of the entire LEAD initiative. That was, again, a 3-year grant term. That grant ends in 2023. The county just reapplied in collaboration with all the partners of the LEAD initiative for a new grant. That grant is a $1.2 million grant for another 3-year term. There's been other, funding opportunities that we've also applied for LEAD. There was a CDBG grant that was also awarded to the tune of about $150,000 to LEAD. So it's an amalgamation of funding sources. Some of them are coming through the county. Some of them are going directly to partners involved in the LEAD initiative. Some are coming from the state through the county, which aren't yet reflected but will be reflected when there's final decisions on where that money will go to. So again, the mental health department, for lack of a better word, is acting as a pass-through for LEAD.
Okay, so the final chapter has not been written yet on the extent of money that will be spent in Albany County on LEAD.
No, and in fact, all the money that's been spent to date has been spent in the city of Albany. The program has not yet expanded outside of the city of Albany.
All right, thank you very much.
Thank you very much.
All right, thank you, Madam Chair. First of all, I want to comment on the vacant lines, because that's come up with a lot of these agencies. There's a ton of vacant lines in the Albany County budget, and there's no expectation that all those lines are going to be filled. That's never been the case. So, yeah, there are some positions that are required, and it's hard getting people. When we get those people, we'll slide them in. But I think the vacant line issue's been exaggerated this week. Dr. Giordano, first of all, I want to congratulate you for being Man of the Year in mental health.
I didn't see that.
It came across my desk, and it was quite an honor, and congratulations to you. I do want to ask you about question 15.
See, you're buttering me up now for this.
No,
We actually voted right before you got it.
Question 15, you do have, tangible outcomes. 855 people who were served by the adult outpatient clinic, 9,000 inmate patient contacts, 2,700 crisis contacts. That gives you some sense of how just our business and what the challenge is. But my question would be, do we have any quantification on how well we're doing with all these challenges that are meeting? In other words, based on all these contacts, how well do we have some quantification on, how are we the solution in some of these cases or more of these cases? That's something I'd really like to know.
Yeah, well, first I would like to say that the data that was included there was a snapshot. We have similar kind of like measures for every service we provide, and there's many more. But you're really asking the question, how do we know just because we're serving someone if they're getting better?
Exactly.
Yeah. Part of the challenge is that we're dealing with chronic illness, and chronically mentally ill people are not going to necessarily ever be without their chronic mental illness. And some of the folks that we're serving are by virtue of the fact that we continue to serve them, that is a sign that they continue to take their medications, for example, and they continue to come on a monthly basis for service. That is the outcome. And so,
I mean, that's a success.
That
It's
is
just being able to make them, livable, basically.
Yeah.
But that's something to track.
Well, but when we say that we, served 855 individuals in our clinic, part of what's implied for us at least is that successfully. Because a lot of folks, what I learned from my colleagues across the state is that the modal number of visits, or the median number of visits for outpatient mental health is 1. People come and they don't come back. So for us to have them come back and stay and sometimes be with us for an extended period of time, that is a measure of success. But we also do internally, from the moment someone comes in, an evaluation of the symptoms that they're presenting, and then over time, those are measured, and the clinical team, and Cindy's nodding her head, I can see from my personal. Before Cindy was deputy director, she was in charge of all the clinical operations, and we spent a lot of time trying to see, is this person benefiting from the care we're giving? And if they're not, why? Is it the provider connection, or is it a different level of care that's needed? So it's a constant process. We might be able to do a better job of reporting it, but it doesn't escape us as being an important matter.
The veterans group was in yesterday. They didn't know how many suicides there were in Albany County. They said they didn't have access to the information.
Yeah, I can tell you.
Veteran suicide is a big problem they want to fix. Do you have access to how many suicides there are in
I'll
the
tell
county?
you, Cindy wants to.
No, I was just simply going to add, so one of the processes as a part of clinical treatment is that we do regular treatment planning with all the individuals that serve. So while we can't give you a number for the entire, grouping of the individuals being served, each individual is measured with goals, and are they meeting their goals, and then their goals will be changed if they are not adhering to whatever the treatment plan would be. So we are measuring success. We're doing it individually.
Okay.
Mr.
Grimm?
I'm sorry.
I'm sorry. I know we have a lot of questions, but we have 2 more.
Yeah, if we could just get this answer,
Let
and I'll
me
make mine.
finish.
If you can just
We
finish.
have 2 more speakers who are also going to have long, not only their presentations, but also the questions. I'm closing this out, and I'm asking that you put any more questions for Dr. Giordano in writing, so he can respond. But by email, please, legislative email, please. All right? Now, if you're going to ask a question, I want you to ask a question, but don't give the answer.
No, I just want, if he can just finish that answer, I'll be fine.
Oh, good. Okay, good.
Thank you.
So, Mr. Legislator Grimm, in fact, in consort with the Department of Health, we've been working on tracking suicides since 2011. In that period, we've had 425 suicides in Albany County over an
Did you say
11-year period.
25?
How many? 425 over the 11-year period.
400.
Since 2011.
38.6 average on an annual basis. We had 40 last year. There are 17 confirmed this year through September. But I will tell you, and I want to look to Dr. Whalen here because I think we share on this. The data is hard to get sometimes from the coroner, and sometimes it's reported in ways that isn't always easily accessible. But we need this, and as a matter of fact, we have 2 graduate students that are working with our department who are going back and going to analyze this data, do it by zip code, do it by race, do it by gender, and update this information. But it's about 40 a year.
And I'd love to know if they're veterans, how many veterans.
Well, that would be something that I don't know that I would be able to get, but it's certainly important. Anyway.
Thanks so much.
Oh, thank you. Thank you for that question, too, Mr. Graham. All right, we're going to move on now. And I just want to thank you for your presentation, Dr. Giordano. You have a very difficult agency, to deal with. And even though the numbers may be going down in Albany County correctional facility, the fact that we can see the number of people that are being served, those numbers go up. I count that as something, positive, an indication that people are being reached. And so that's one light in this area where things tend to be kind of dark. So I just want to thank you for your presentation. I want to thank you for all of the work that you all do.
Thank you, Madam Chair, for your support. Appreciate it very much.
Okay. As we're transitioning from one to the other,
For your reward.
there's 5
I
minutes.
gotta find out about that.
We're going to recess for 5 minutes. 5 minutes. Come to order. I know everybody's feeling a little punchy right now, but we will now come to order. And we have moved on to the second half of Session 3, Human Services Part 2, and that is the Health Department. And we have in front of us Commissioner Elizabeth Whalen. Is Mary Beth Miller?
No, she's not here, but I
Oh, she's not.
have Shannon Witherspoon, Assistant Commissioner for Finance.
Okay, Shauna Witherspoon?
Shannon Witherspoon.
Shauna Witherspoon, okay. And Mr. Riley, we know.
Yes.
Just me.
Good evening, Madam Chairwoman. and-
Oh, can I just ask you to do one thing?
Sure.
Speak up.
Okay. I used to do plays in high school, so let's see if I can remember those days and get this in at a level where everybody can hear me. Good evening, Madam Chairwoman and members of the legislature. We are happy to be here tonight to present our 2023 budget. We worked hard to create a fiscally responsible plan and are happy to state our county share is 35%. Highlights of the budget include ongoing funding for COVID response through our ELC grant, which has included expanded coverage for monkeypox as well as COVID. We continue to work with schools and other partners to ensure safety in these settings and ensure widespread availability of vaccine and other preventive strategies. Also new this year is grant funding for closing the gap with social determinants of health. This is CDC funding to continue to address racial and socioeconomic health disparities in the county, which is in keeping with our mission. Finally, we are very pleased that this year the New York State Department of Health has increased our Article 6 funding. This is something that doesn't happen very often. It is a yearly, it's called a grant, but it's kind of a misnomer because it is something that we always get year after year. This is continuous funding to support essential health services. So importantly, it is not specifically tied to COVID response. We received the increase on both the Article 6 base grant, and there has been expansion of the funding from the State Department of Health to allow us to use a higher percentage of their funding for considerations such as employee fringe. This increase in funding has been covered in the press as an effort to target recruitment and retention for local health department workforces. We've highlighted in our narrative the ongoing challenges with staffing, which is a problem occurring across the healthcare sector. For us, this has been a long-standing problem, as we in Albany County are located close to the New York State Department of Health and numerous opportunities in the private health sector, which offer higher rates of employee compensation. We are in discussion currently with the County Executive's Office about using this new funding for the purposes that it has been earmarked for, and also separately union negotiations for our union staff remain ongoing. In the budget, the enhanced pay line on page 122 of $419,000 reflects a portion of this funding that is anticipated to be used for union salary enhancement. We're hopeful with this increased funding that we should be able to come closer to achieving a full complement of staff. Grant funding has been used to continue to support technological increases, including computer equipment, office supplies, and medical supplies. We continue to work hard to respond to an unprecedented 3 current public health emergencies in New York State, which are COVID, monkeypox, and polio, in addition to continuing the myriad of programs and services that the county health department is proud to offer the residents of Albany County. I'm happy to take questions.
Okay, thank you very much. I'm just going to start with some questions, and then I'll open it up. The chairperson of the health department is here, which is Mr. Joyce, Ray Joyce, excuse me. Your part-time nurses are down substantially. Why is that?
Well, we've had a number of resignations, a number of staff that have left us for other positions, and we have challenges, as I said, with recruitment.
And your office supplies almost doubled?
So that is all grant funding. A lot of it is due to the ELC, the funding for COVID response.
And your printing and advertising, 5 times more.
Go ahead, Shane. So yeah, that's also due to grant deliverables. We received a substantial amount of money due to surrounding media campaigns and education, so we put that funding in the printing and advertising line.
Okay, thank you. All right, and my last question. The cooling tower regulatory oversight. So there's no funding from the state for this? All right, how do you see your department sustaining these requirements without a funding stream?
Well, you know, we are not strangers to unfunded mandates. You know, this was something that required a considerable outlay of building infrastructure in the beginning, getting the locations of all the cooling towers in the area, ensuring that they are submitting in a timely fashion the tests that they are required by the state to submit. And we do, you know, follow up with those that are not in compliance. So right now we are able to make that happen, you know, I'm not going to say that it wouldn't be helpful for the state to provide funding for that.
All right, thank you very much. Mr. Joyce, do you have any questions?
You know, no, as chair of health, we visit every month, you and Ms. Witherspoon, and we know there's nothing here we don't know. We've seen it month and time again, the challenges you face is, just going through a pandemic, and we're not even through it. We just talked about it last month, or last week, about the recent deaths in Albany County. There's been 7, so we're still in the middle of this thing, and now you're facing polio and tuberculosis and monkeypox and all these other things, and I just can't thank you enough for everything you've done over this past year and past 2 years for Albany County. I'm really proud of the work you've done. So, like I said, we do this every month with the Department of Health, so there's nothing in this that really stood out to me, so I have no questions.
Thank you very much. Mr. Peter.
Thank you, Commissioner Whalen. Thank you very much for, again, everything you've done. I think the county, comparative to the circumstances, did excellent during COVID and the best we could. And I know you led those efforts along with the other department heads and county exec's office. I guess first I'll ask this because we've asked every other department for it. The enhanced pay line, $419,000. What do we got there?
So that is money that came from this Article 6 base grant and enhanced funding from the state. It is continuous funding, so it's not just a one-time only effort, and you know, it's being targeted at this point for ongoing conversations with union and other discussions.
Got it.
Okay.
No,
On that point?
No.
Okay.
I guess the second thing is, as we're, you know, one of the things that I think Albany County did well during COVID was trying to make sure that the vaccines and other things went to communities of need to help, you know, get through that, whether it was the elderly or in minority communities and things like that. Are there any long-term plans for more preventative sort of healthcare clinics and other things for continued health? The reason I say that is, you know, during an emergency, you know, we sort of had to start from scratch and how to connect to some of these communities that either didn't trust the system, didn't know how to get in touch with the system, weren't traditionally like knowledgeable of things. But we're now seeing with monkeypox and COVID Part 12 and, you know, everything else that none of this stuff is going away. And some of the ways to help with some of the vaccinations to actually be out in the community and earn the trust. So are there any sort of future plans on preventative clinics like that?
So a couple of thoughts on that. First of all, we've been out in the community since the inception of the health department. We have community health workers that go into high-risk neighborhoods to help moms and babies to improve maternal child health indicators. We work a lot on chronic diseases such as asthma, diabetes, hypertension, you name it, whether it is conducting educational efforts or linking people to care in their homes. It is something that we have always been involved in, and as I stated in my introductory remarks, we are particularly focused on improving the racial disparities that we see in the healthcare data, which, you know, needs ongoing work. We partner with a number of agencies in the county to get that work done, whether it be community-based organizations or our healthcare partners. Secondly, it's important to note that the health department does not provide primary care to residents. That's more in the healthcare sector or the federally qualified health centers. But we do obviously respond to public health emergencies. So we really, obviously we've learned a lot from COVID. I think that, this was made efforts around, for example, our monkeypox response much easier. We are really, the strength of the county health department is that we are familiar with the county partners. So, for example, for that effort, we immediately formed a working group with representatives from the Pride Center, from In Our Own Voices, from the Damien Center, from the Alliance, and asked them, what can we do? What are helpful ways to get the messaging out about public health education and vaccination in the communities? So they were able to work with us to do things like set up clinics in unusual places, maybe where people were comfortable. We operated a monkeypox clinic at Waterworks Pub, which was very successful. And then we've had a number of clinics there. And we were at the Damien Center as well. We continue to have COVID clinics as well. And, we have many of these clinics have been through partnerships with community-based organizations and others, and with you as well, because, you have been very helpful to provide feedback to us about how to get into the communities that you particularly serve. So I appreciate all the collaboration from that going forward. That is definitely part of our mission going forward, to be working the boots on the ground within the community. That is definitely what we continue to see our vision being in the future.
And my final question, thank you, Dr. Webb, is are you working with any of the hospitals or Planned Parenthood or things like that on getting information about prenatal care and things like that out into the community? Just given there's been a number of reports on, more recently on issues and disparities within, pregnant populations.
Well, I'm very happy that those data have made it into the public lens, because this is a problem that we've been working on for many years. We've formed collaboratives, again, with community-based organizations, with our hospital partners, with Whitney Young and our providers. And we have maternal child health nurses that go out into the community. They help formulate plans with pediatricians for high-risk babies. They help provide prenatal planning for moms as they're expecting. So this is something that we have always realized is a huge public health problem. And I hope that, some of what comes out of COVID is that there has been more of a highlight on these disparities that the press is paying more attention to. And with that recognition, hopefully, there'll be more infrastructure that we are able to develop.
Thank you, Dr. Webb.
Thank you. Mr. Bergdorf.
Thank you, Madam Chairwoman. Doctor, welcome. I have basically 4 questions. Under your new initiatives, you talked about an Albany County pre-K to 12 instruction program, which you hope to undertake in the coming year. What's that all about?
So it's not a pre-K, it's not an instruction program for the pre-K. Is that,
Okay.
Are you referring to the ELC grant?
No, I think it was in your...
I think what that is that we are working with schools on testing for COVID. Some of the schools still
Okay.
want to provide that testing. We are also working with schools. We have school specialists. If there are outbreaks in schools, we work with the school nurses to ensure that they're using appropriate control measures as necessary, and anything that they need. I know that the group here is aware that a large part of that funding to support the health of that K through 12 population has been spent on providing air filtration equipment, et cetera, testing supplies, and other medical supplies for the K through 12 population.
Okay, all right. I think you had listed it in your programs for next year, which didn't have a finite dollar figure set to it. There is a huge decrease in nursing COVID EPI schools from 3.149 million to 50,000. Is that just the day-to-day inoculation of kids, monitoring, testing, et cetera?
So we originally received the grant funding in 2021, and the total grant funding was $6.6 million. And when we came to the ledge to ask for approval to accept the grant, we put $3 million in the first year in 2021, and then we added 3.3 million the second year. So most of that, what we haven't used is in encumbrance, so you won't see it in the 2023 budget. What you're seeing in the 2023 budget is the remainder, which will go to personnel. So most of the contractual will be in encumbrance, since it was already booked in the 2021 and the 2022 budget, so you won't see it in the 2023.
So it's sort of a reappro.
Yes.
Of, and how much is left in that line, Dave?
Actually, Shanna's probably far better to answer that than I.
We have a little over almost $1 million, I believe.
Okay, so it's not as large a reduction as it appears. Okay, there's a program, and I'm sorry, I'm like Ray, I'm not good with the acronyms, PHEP-EPI, new program, $775,000.
So PHEP is Public Health Emergency Preparedness. Obviously that's tied to response to public health emergencies. We certainly have utilized that staff in those programs in recent years, that a lot of that funding that they receive is to support not only response to concerns we're currently facing, but to conduct drills. So, we do drills for potential bioterrorist events or, other infectious diseases such as smallpox that could represent a bioterrorist emergency. We also support a very large volunteer sector through the Medical Reserve Corps and the Citizen Reserve Corps, and we really have been beholden to them throughout COVID and continuing, because a large part of the staff that provided all the vaccines in the county were volunteer health professionals that came and assisted us at those pods.
Will that program be ongoing over years, and where's the funding come from? Is that grant funding, or is that county money, or?
So that's grant funding. The acronym there is Public Health Emergency Preparedness, but that is, the $775,000 is a culmination of our ELC grant. We just put it in that line. I just named it FEP because it's our Public Health Emergency Preparedness. So,
Thank you very much.
This ends, it's slated to end March 31st, 2023, but we got the extension. We're getting an extension to be able to spend the money throughout the entire calendar year of 2023. So it will end December 31st, 2023.
Now I have a thought question for you. It's a public health theoretical question. In the news over the last 2 days, there is a brouhaha between probably the most dominant managed care program in the capital region and the Trinity Health Group, St. Peter's Partners. If that does not resolve itself, and a lot of people find themselves without their doctors and with the wrong coverage and stuff like that, is there any role for the county to help mitigate some of the outfall?
So, you know, the role, first of all, I think it will get it will get resolved. It pretty much has to get resolved, but I don't have any insider knowledge of those discussions or what's happening. It is the role of the county health department to ensure that people have health care. So, you know, if we find a number of people that are suddenly out of medical care, likely the first responsibility will be on the managed care company to steer them in a direction of a provider that is within the network. But, you know, we'd have to see how that goes. It's kind of unprecedented for something like that to happen, so I can't speak from history. I will say that that is our role, but generally that's something that we deal with in ones and twos, not in giant populations of people.
400,000
Yeah.
people enrolled in CDPHP.
I just want to, you don't want to get too far off into that.
No, I,
Ray?
The Commissioner addressed it, and also.
Okay, very good. Mr. Griffin?
Thank you, Madam Chair. I'm looking over your performance measures, and to me, it seems it's more about all the activity that you're involved with, which is pretty substantial. But it doesn't seem to me to present a clear outcome of what we're working on. And the thing I'd like to see most is some quantification on how healthy our county is. So like maybe an index every year, the health index. Basically, you do get a lot of data, you know, you don't have data for everyone. But I'd love, because you're pretty clear about your mission too.
Yep.
But I'd love to be clear about, this is how we've done this year, this is how we want to improve next year. You know, that's really, it seems to me as the baseline is, what is the health index of our residents?
Well, I would like to say that, Mr. Grimm, I share your wishes, and I, on a daily basis, wish that, you know, we had better infrastructure. This is not something that is just at the county level. There is recently, NISAC just put something, I think it was NISAC yesterday, about the conundrums of data in public health. Currently, the way that we kind of do things is every 3 years, there's a community health assessment, which comes out. It's a multi-county assessment, and it's on our website. You can look at that data. And there are a ton of health indicators that are reported out through a multitude of different data pathways. So whether it is from hospital data sets, insurer data sets, you know, surveys that are done on the phone by the state health department or the CDC, all of those kind of give us a picture of what the health of the county looks like. Now here's the problem. That data is kind of held by New York State Department of Health. It takes the state health department 2 years to clean that data. So right now, we've just been through the biggest public health emergency of any of our lifetimes. And determining how that has affected other health indicators, chronic health disease indicators, is going to be, you know, our data is so outdated because the data is from 2019, it's from pre-pandemic. What does that tell us right now? Not an awful lot. So, you know, we learned during COVID to be able to kind of implement systems of real-time data, looking at our case counts and, you know, how many people were in quarantine or were coming out of quarantine on a daily basis. It was tremendously challenging. But to be able to do that with all health indicators really is something that we need a giant infrastructure collaboration with not only local health departments, but with the state health department and with the CDC. And I'm happy to say the CDC is launching a large data initiative, realizing that, you know, I think that we have a public right now that expects that data is the same for health as it is for business. And the business sector can afford these gigantic packages to be able to look at things and just say, well, here's what you searched on Amazon yesterday, here's what you're likely to buy tomorrow, so I'm gonna, you know, advertise. Those things are possible to have for health, but right now they're not funded. And that is not something we can necessarily solve at the local level, but I know that the county executive is very committed to a data infrastructure project. And I hope that in the coming years, this will change so that we can be able to answer your questions and mine in a more timely fashion.
And Dave knows we've hired data people all over.
Mm-hmm.
And because you really don't know how well you're doing. unless you, because you're so committed
Yeah.
to these goals. But maybe it's working, maybe it isn't. Unless we have the data to drive the strategy, you know, it's, where our hands are kind of, one hand is kind of tied behind our back.
Thank you. Ms. McLaughlin?
Thank you, Madam Chairman. Dr. Whalen, thank you again for being here. And I wanted to also, you know, talk about some of the collaboration that took place over the last year, continuing to take place regarding vaccinations and boosters, and how important it is that there has been, and that there was and continues to be, a proactive approach from members of the community to make sure that they have access to vaccines and boosters at this point. Because we ran into the same thing initially when we talked about the boosters, particularly and then the monkeypox vaccine. We ran into some of the same questions that people said, I can't get it, this one doesn't have it, I can't get it in my community. So we just want to continue that conversation so that we don't have the same issues we had 2 years ago when we started the whole pandemic and trying to get vaccines to the greater community. I also want to reiterate the question that Mr. Joyce brought up about the water quality. I just want to go on record that we're asking these questions today, 2022. I always rave about the water, about how, you know, we should be selling our water here because it is so good. I want to be able to continue to say that, and I don't want 5 years from now somebody to be telling a different story. So I just want to go on record that even though I see this negative number here, I want to make sure that there's money being put in place to ensure that our water maintains the quality that we've come to love. And my last thing is, you talk in your next year projects about a 23-25 community health improvement plan. Do you have, is that a document that we can
Yes, the
get?
Community Health Improvement Plan is a document. It is, so I talked a little bit before about the Community Health Assessment, which is the data that we look at. And then from that data, we convene a very large group of stakeholders to talk about what are the focus areas that we want to work on using a collective impact type strategy for the next 3 years. And that's the Community Health Improvement Plan. So that's something that we work with many members of the public
So is it a document that I could read?
Yes. Yep, it's on our website,
It's on
and I
your
can
website.
certainly send it to you. Currently, I don't know if our latest chip has been released.
No, I think it's the previous one.
Yes, the previous one is out. They're just wrapping up the finishing touches on the most recent one. It's every 3 years.
Okay, so I'll look at the past, but if there's, as soon as the new one is available, I'd love to have it. Thank you.
Thank you.
Thank you very much.
Thank you.
You're very welcome. I appreciate the presentation that you gave. I did have a question. You don't have to take a long time to answer. The whole thing with the abortion issue. Have you seen any change or in numbers or in issues, you know, in the community, you know, with women in regards to that issue? Or do we have any women coming into Albany County for services and so forth and so on?
Yeah, well, so we don't provide those services, but we do have an STI clinic, and we certainly have heard from many women in the community that there's significant concern with the overturning of Roe v. Wade. So, you know, and I know our partners at Planned Parenthood have concerns and continue to advocate for women's rights, as do we.
All right, thank you very much. Did you want to say something, Lynn?
There has been an uptick of out-of-state people at Planned Parenthood locally.
All right, thank you. We appreciate the services that you have provided. You know, we worked with you over these past 3 years. Started out a little rocky, a lot of frustration in the beginning, but I think in the end, and I hope that we all learn something from this, and that the people that are being served, as far as I'm concerned, are part of the stakeholders, because they do need to be able to have their feet underneath the table in the beginning. Not at the end, but in the beginning, to really understand how different people from different cultures need to be served, how you can reach them and so forth and so on. I also hope too, there are different things that may occur. And I'll just use this example. We know that people of color have sickle cell. We also know too, even when they had the whole thing with AIDS, that the medicines that they came up with for that, black men had an issue with it as far as, so I'm just hoping that these type of things, and this is being gathered through this whole COVID experience here in the way in which people are being treated. But I do thank you for your service, and I thank you for all of the work that you all have done, because I know it hasn't been easy. So I do appreciate you, and I just want you to know that.
Thank you very much, and I want to say it goes both ways. I mean, I look around the table, and I've had conversations one-on-one with most of you throughout this, and I've learned a lot from all of you, and so I want to thank you for that collaboration. It was essential to the work we did.
Thank you very much.
Thank you, Dr. Lowe.
Thank you, Dr. Lowe.
Thank you.
And last but not least.
Never
Vehicles, Bessie.
Mr. Slack.
Good evening.
Always give it on. Slack key.
Yes.
I got it, I did it right. Okay, so who's the gentleman that's sitting there next to you?
Mr. Frank Camiso, he's our CFO on site,
Okay,
handles all the money.
all right, are you ready with your presentation?
We're ready. Okay, I would like to thank the chair and the committee for allowing me to present the Shaker Place Rehabilitation and Nursing Center 2023 budget. It has been a true pleasure working with the county executive, the legislature the past year, and the staff of the Albany County facility. Next year's budget comes with some challenges, but I feel that we have properly accomplished this task. And what we created will meet the needs of our operations staff and, of course, the residents. Some of the items of note are as follows from our budget that we have submitted. We have increased our private pay revenue line by $1.8 million. This increase is justified by the fact that we now have 39 residents at Shaker Place who are private pay, which represent 13,884 days.
Could you repeat that in
That we
louder?
now have 39 residents living at Shaker Place every day, unless one would be discharged or someone admitted it would go up. And those 39 people annualized living at our facility equate to 13,884 days of private pay dollars. And our average private pay rate is approximately $500 a day. So we increased our private line in our budget by $1.8 million. Compared to last year, or the year we're in right now, we'll probably average around 10,000 days. That's why this increase is justified. We'll also be increasing our semi-private rate January 1st by $25 a day, and that will bring us to that $1.8 million. We've also decreased our IGT line in our budget. We made this decision to lower our IGT payment because it's a lag payment of 2 years. And this reflects the actual Medicaid days of 2020, which was the first year of the pandemic. So census was low, and at the same time, if you remember, we were in the middle of our construction project, and our average census during that year was 165 residents a day, and the IGT is based on Medicaid days. So to be more realistic to what the number truly is, we lowered it by $1.9 million. We also increased the personal non-individual line in our budget. We made this decision to increase the temporary help line to fund per diem staff who will work with Jacob Place versus hiring an agency staff member. This decision will save the nursing home about $12 an hour and provide our staff with flexibility in their schedule and, of course, decrease agency use and overtime. This is a work in progress and will be monitored throughout the year. We increased our personnel advertising budget line by $80,000 to fund Eglego, our new outsourced recruitment agency, where they hire staff for Shaker Place. We pay a monthly fee and a per-staff member fee when someone is hired. However, they also conduct all interviews, set up appointments, check references, and perform all advertising, which allow us to eliminate other charges previously budgeted for, such as Indeed and paper advertising. That's now been eliminated. As you will note, our interfund transfer has increased by $4 million. This is because we have increased our budget staffing lines to comply with the New York State Department of Health legislation that now mandates 3.5 hours of care a day per resident. We also increased the environmental service budget lines to effectively cover our new facility square footage and to ensure weekend coverage. And as stated above, we decreased our RGT, which is representative of half of this increase. Currently, we have 125, that's 125 part-time and full-time vacancies, that's staff vacancies, which are funded in this budget. And as they are filled, overtime and agency budget lines will be decreased. And with our increased census, our IGT will begin to get back to normal levels. With these assumptions, even though we have increased our loss for 2023, which is an all-in budget, we will be able to cut into the loss and work our bottom line back to being in the black. Finally, we are moving full speed ahead with our child daycare center. And we conducted our on-site construction tour today from the RFP that is due back to the facility on November 17, 2022. And if we can get this contract on the November 22 calendar and materials are available from to the construction company, we should be able to commence the construction by January 2023. It should be noted that we have also submitted to our New York State Department of Health our certificate of need for reimbursement for this project, which is approximately $4 million. And hopefully all of that will be reimbursed. As for the garage project, we had to revise the architectural drawings due to an underground line controlled by the FCC, which is being completed now. And we also needed to have work completed for the SECRA application. So I believe at this time the project will commence in early spring 2023. I hope this answers some of the major questions within our budget, and I now could respond to any of your concerns or questions.
Thank you very much.
Chair?
Mr. Peters.
Thank you, Mr. Slacky, and thank you, Mr. Comissa, for being here. You did answer a large amount of the questions, so luckily that counts some of mine out. But I guess the biggest question is, I know we talked about a little bit of that nursing home deficit that you said after 2023 we should be able to dip into the losses to come and get back to the black. What are the strategies you're going to use to that, or one of the major factors to getting back to the black in 2024?
Well, right, first of all, I'll be honest, since I've been there, we've never been in the black.
No, understood.
and that right now that the facility is there, our census is up, that's my number one goal, other than, of course, quality of care and the standard things that we do every single day. So I believe that our private census and Medicare will continue to rise, meaning taking care of residents that have a higher case mix, which of course increases our revenue. If we could fill a lot of these vacant positions, and as you can see, we have 125, that's all disciplines. And a lot of them also are part-time. If we could fill them and reduce our overtime, which we've now budgeted at $1.5 million, that number really should be more like maybe 10 to 15,000 a week, maybe, $500,000 a year of overtime. So yeah, I have $1 million there. Our IGT, right now, if you do the math, our IGT is probably based on around 50,000, 48,000 Medicaid days. Our current census of Medicaid days is over 70,000. So our IGT, I think, is going to go back to around $7.5 million. Right now, it's around $4 million. So if you could cut the overtime, let's say by $1 million, the IGT goes up by $3 million, that's $4 million right there. And our census, you can see originally under the 2020 budget was 165. This morning's census was 243 with 5 people in the hospital, meaning our residents in the hospital. So basically we're full. We have 60 people on the waiting list. I can see only positive signs of not using agency. If we could fill our positions, that is budgeted for $500,000. I think if you put all those things together, we're going to be very close to the back, or making a few dollars.
Just a quick clarifying and then one other question, and then I'll set, Madam Chair. So you said that we're seeing an increase in sort of the bed count and things like that, that you're seeing the census data on that. Sorry, you had mentioned that the census data is already larger than what was reflected in the 2022, moving into 2023, right?
I'm sorry, I can't hear you. I apologize.
I believe you said that the census data is already higher, right? How many beds we're expected to fill and things like that
Yes.
into 2023? So are any of those numbers reflected in the 2023 budget under assumptions, or is the 2023 a conservative budget that if you're correct, we're going to see a lower deficit overall?
It's a very conservative budget.
Okay.
And I believe that, especially in IGT, again, we've been carrying IGT for $2.5 million with this low Medicaid. And even though we were showing a loss of around $2 million, $2.5 million, this brings it really to what it is. And it's a very realistic and a conservative budget to show the real numbers of the nursing home.
Got it. And Madam Chair, one final one. I know we've talked about the garage construction, things like that. Are there any green infrastructure and solar plans with regards
Yes,
to that?
the garage actually will have solar. So the daycare center will not, because it's part of the nursing home.
Understood.
But the new construction that we're doing will definitely have solar. That RFP actually would have been on the street already, but during one of the surveys, they found that there was the FCC line going through our property. And I don't know, when you go up, 155 off Albany Shaker, that big, radar thing up there?
Yep.
That wire goes through that piece of property to that. And they were afraid that if they construct the garage, so they had to move the garage, which means they had to move, everything in the drawing.
Understood.
So,
All right. Well, thank you, Mr. Slatke. Thank you, Mr. Commisso. I'm good
Okay.
on my end. Madam Chair.
Thank you very much. Do we have any? Mr. Bergdorf?
Thank you. And I'd like to thank Larry and Frank, because this time last year, I had a loved one in Shaker Place, and you see a whole different side of the budget when you are a consumer than you see when you are doing government and budget oversight. So I can't say enough about the facility and the staff and really caring people. But a couple of questions that are technical in nature. Larry, you talked about the IGT going to, going back up to the $7 million level over 2 years. Will that happen in 2 chunks? Like, will it happen, half of it happen in 2023 and then the rest of it in 2024? Or is the IGT calculated on like 2-year increments?
They are always a 2-year lag, and they usually make 2 payments of IGT.
That's correct.
So, but the problem is always that lag, If we could get the IGT payment based on our current census, we'd be very happy. Unfortunately, we're still dealing with the pandemic days. So when we get into 23, they'll be looking at 21, so to speak. So this is extremely conservative that we lowered it, knowing that 23 is going to be looking at 21. But 21 was also low. We didn't really start increasing our census until the beginning of this year. It was creeping up, but not like now. Now we're 240 or more every single day.
Thank you. You talked about a temporary help program, which you hope will reduce the cost of the agency hire program. How does that work, the temporary help? Where do those folks come from?
Yeah, I'll tell you how we did it. This is what we found. When we were using agency, they're basically per diem. The agency, they come and go, work when they want to work. We're paying our agency respectively for CNAs anywhere between $45 and $48 an hour. So a lot of our staff or people that this new company at Lego gets us want to work per diem. Even our current staff are on payroll. I said, but you're going to give up your pension, give up your health. We'd rather have more money, and we'd rather have a more flexible schedule, even if we give you 5 days. So we created a per diem line with the assistance of Dave Riley and company, his staff, which help us every single day. We created this per diem line, even though it was there, but added money to it and pay our staff or our new staff coming in $33 an hour. That's how we got the savings. Minus 48 or minus the 30, the 45 gives us that savings. So instead of paying an agency, we have control of the staff that are working for us and giving them basically the same benefit. And the reason we went to $33, we found out from the agency what they're paying those people that are working for them. So they were paying them 30, 31. We paid them 33 to get them to work for us, and and we're still saving money. It's an okay program, but we need them to work when we need them to work. And one of the mandates of that program, by the way, is you have to, unlike the agencies, there you're going to work whenever you want to work. With us, if you take that position at 33 an hour, you have to work every other weekend. If you don't work every other weekend and you miss a weekend, all right, we give you a warning, you miss a second weekend, you're gone. So,
Did that require an MOU with the unions or
Oh, no.
anything like that? That's strictly,
no, we're allowed to hire per diem, it's in the collective bargaining agreement.
Okay, all
And we
right,
can
that's
set
great.
that, and we can set that salary.
and one
How
last
many more
quick,
questions do you have, Mr. Britton?
and it was a sort of a follow-up on what you said on the daycare center. You said you did a walkthrough for the RFP, and you said if things went right, you hope to get something on the November calendar.
Well, what I did is I put a placeholder in, the first of, I don't remember the exact date, but it was last week. I put a placeholder in, knowing that we're gonna have to site visit for the construction company who's actually gonna do the work, but I didn't know who they were. So I put in to be named, I put everything in, but the
TBD.
money and the company and where they're located, but it's there. Now, we had the walkthrough today. We had around 7 different companies actually walk through. They will have to submit by November 17th. I already spoke to the team that are going to review that. One of them is Mike Martin and Andy Lucaretti, well, I guess 2 of them. And there's one other person that will look at that, probably John Neary. They'll come up with a decision by Friday or that following Monday. Once we have that, we send it over to procurement. They'll look at everything, validate everything, give us a concurrence letter of approval to move forward. Then I'll complete that RLA, and then I will call Mr. Riley here and say, can you please, look at this, see if it's okay. I know it's submitted late, and see if you could get on your November calendar so it can be looked at, hopefully approved by the legislature, then go to the full ledge the following month, get that contract in place by December, and then hopefully by January they're working.
One thing you ought to be aware of is that the November calendar for committees is accelerated. A couple of the committee meetings meetings are happening the week before normal.
Right.
So your turnaround time between getting the numbers and getting something on a committee agenda.
Yeah, I
might be
mean,
really-
once I get we're talking like everything for me can be done in a day. So once they finish that review, I believe the 17th is a Thursday, something like that. And if they can do that review right away and get it to me by Friday, I'll complete the RLA on Friday, make the phone call, everything's there, and hopefully we can get it looked at. If not, we'll figure out, how to get it done. But hopefully that's the plan.
Do you have the management contract? Is that?
Well, we're not going to use a manager here. It's just, our daycare
No,
center.
I mean for the operation of the daycare facility.
Oh, yes, that's already been approved. We actually got that approved almost a year ago. That's going to be the Colony Youth Center. If you remember, that's the Colony
Yes, I
Youth
do.
Center.
I just didn't know if that needed blessing.
Yeah, we're really going to be the landlord.
Okay,
Yeah,
so
okay.
this is what we're gonna do.
Got it, sorry.
We're gonna go to Ms. Lakakis, Carolyn McLaughlin. Did I see?
She knows her.
Okay, thank you.
Wait.
Wait. Mr. Katz, Mr. McLaughlin, then Mr. Grimm, okay? That's why I like to sit next to you.
Thanks for showing me out.
So, this retention stipend leapt out at me when I was looking at this, and I just wondered, could you briefly, how long does it go on? Is it just a one-time payment after a certain amount of time?
The
or does-
stipend?
Yeah, the retention stipend?
Well, the retention stipend, as of this past Sunday, okay, that we've been giving to our staff is eliminated. And that stipend will now become part of their permanent salary going forward, starting this past Sunday. And the reason why we did that is they were getting it anyway, but the nursing home needed the hours. We were getting killed when CMS changed their regulatory requirements for reviewing this 5-star rating for CMS. Because all of our staff are on a 35-hour work week. They're in the building 40 hours, hour, whether it be lunch, break, lunch, unpaid, but paying them 35 hours. So by making the stipend permanent and put it in their base, at the same time, they agreed to work an 8.5-hour workday. 8 hours of work, which is really the normal work, but a half hour of unpaid lunch, 8.5 hours a day. So we're taking that stipend, which they were getting, adding into their salary, but now times it by 40. So they're actually making less per hour, but the same amount of money per week that we were already paying them. But the benefit of that is we're now collect for every single person who's full-time 40 hours a week versus 35. It comes out to around $2,000 a month, $6,000 every quarter in our submission. And I'll believe that we're now 1 star in staffing, that's going to jump to 2, maybe 3 stars, which will bring us to a solid 4 overall, and maybe for the first time ever a 5-star. And it's pretty, well, when I look at these ratings, there's really a little bit of a problem with it. And even though they're trying to accomplish quality, it makes no sense that a nursing home, our nursing home, could be 1 star in staffing, but we're 5 stars overall in quality. So the staffing's supposed to equal the quality, that's the argument. Well, we're 1 star in staffing, so it shows the way we calculate staffing gives us a lower number. But we probably have the same amount of staff, or more than our neighbor, but they may be on a 37.5-hour work week, or 40, and it works by how much you get paid, meaning how many hours you get paid for, okay, versus how many hours you're actually in the facility. So this will fix that problem and make the stipend permanent.
Okay, I want him to clarify something. Go ahead.
Okay, go ahead.
Okay, are you talking about CNAs or are you talking about the nursing staff?
I'm talking about both. The CNAs and the nurses were both receiving the stipend. So they will both be now working 8.5 hours a day or 42.5 hours a week. But the actual work, in all honesty, that they've been doing doesn't really change. They are in the building an extra half hour a day. That's the agreement to make the $4 that they were receiving already permanent. And we'll be able to capture those 40 hours.
At $33 an hour.
Well, what's gonna happen is whatever they're at, huh?
No, the 33 is the per diems.
Oh, the 33 is the per diem. And they don't get benefits.
Oh, okay.
Yeah, they're not changing. The per diems are, they get paid for the hours they work. They're not, that's not changing.
Yeah, what Mr. Slackey's talking about is our actual county
Correct,
employees.
Right. These are the people who are on payroll,
Okay.
our payroll, who get stipends. We do not give stipends to agency or per diems, period.
My next question is my regular question, which I don't think I asked you on Zoom for the last 2 years, but I do think of you as kind of a wizard, and I have enjoyed watching you do what you do for these last 6 years, so I need to ask you, as usual, do you remember what the question is? I wanted to talk about, how's your succession plan going?
Oh, yeah.
Well, one of them is over there.
Okay, good. All right,
You know, Sean is my deputy.
you're still whispering your secrets to everybody?
Yeah, Sean Thelen, which most people know, is now the deputy of the nursing home. And he works with me every single day and going on rounds and you know, no, I don't know if we have a staff member, we probably have a couple that have been there longer than Sean, but not many. So he truly knows the operation. Clearly, he knows the finance. Okay, so I think when the time comes, if he chooses to want this and people agree that that's what the action that should be taken downtown, then that's what will happen. So we work on a succession plan. Director of Nursing has an assistant. Frank has two really good people in his office that work with him. That's one thing that we think about every single day in departments. I'll be honest, we just had, I don't know if people know Susan Short, but she was the medical librarian for the nursing home for over 20 years. She just retired. Actually, 2 days ago was her last day. Siddiqa Sales is the person that was her assistant, also qualified, ICD-10, has all of the degrees. We knew that eventually Sue would be retiring. She was ready to go. We moved her into that position. One of our CNAs, we've been training in ICD-10. She just got her associate's degree. She is now moving from CNA to take Siddiqa's position, and that will be the succession plan for Siddiqa. So yes, we do think of that.
Excellent, thank you. Carolyn, I think it's you.
Carolyn?
Thank you. Do you believe, thank you, I do want to say publicly, thank you for the work that you've done and how we've been able to establish a good working relationship and over these last 2 years, and I so appreciate it. And your staff, how they are very responsive. And in light of the daycare center coming, do you believe that that will help you in recruitment?
Oh, definitely. I mean, that is really, I don't want to say it's the only reason why we're doing it, but it's one of the main reasons that we believe that that daycare center, that staff members, when they know they can come to work and leave their child in the same building where they're working and being cared for during their shift, is going to be a huge plus. Plus, we could offer discounts for those people who work for us or work for the county and leave their children with us to care for. I think it's going to be a plus all the way around. It's a great service. You know, we're in a beautiful location for a child daycare center. I mean, a lot of child daycare centers are not in the best of neighborhoods and don't really run the way they should run. This is going to be really a 5-star child daycare center. We have a beautiful piece of property, you know, in front of that building, which will be a huge playground for the kids to go out and play. It's going to be spectacular. When you see the plans, I mean, it's going to be beautiful.
So ultimately, your resident to staff ratio will probably, staff will go up ratio with.
Well, clearly, you know, we go from 35 hours to 40 hours, it's going to jump right away. You know, there is a state mandate from the legislature of getting to 3.5 hours. That went into effect January 1st. Fines went into effect April 1st. I only know of a couple facilities in the entire state of New York that are reaching 3.5. This will get us very, very close to 3.5. And by the way, even though the positions are vacant in our 23 budget, we budgeted enough positions, if filled, will get us to the 3.5. That's why our losses actually increased, even though the positions are vacant. On paper, there's losses, but if filled, they do get us to the 3.5.
So, and I look forward to that. And with the recognition that you received this past year, you're as one of the best senior living facilities in the Capital Region, and also noted in Newsweek as one of the best nursing homes in New York State. Those are great accolades, but no place is perfect. And I know that, I mean, I hear stories all the time, a number of us do, but, you know, I continue to push the nursing home as a place of first resort for people. And I want to be able to continue to do that. And one of the things, have you ever thought about, and is there any way that we, as legislators, can advocate on the state level, and or whatever level that we have to do it? Because of the staff to resident ratio sometimes can be a challenge. And residents, and these are the things that we hear sometimes, well, my loved one was left alone. I came out for their lunch, and their lunch was just sitting in front of them, and they need assistance. There's nobody to assist them. Is there any way that we can advocate where, and I know there's a liability issue associated with this, if I had someone there, and I had a CNA or a trained nurse, that I, as a family member, that I wanted to come and sit with my family member all day long to help them out, I'm paying them. Is there any way we can advocate for that kind of activity to take place in the nursing home?
Well, we're allowed to do that. If you have a family member who's in our nursing home, let's say you have a mother who's a senior in our home, and the daughter would like to come in every day and feed, their mom. We have a training program. It's in place. It's around 3 different hours of training. Some people do it in 2. There's no real time requirement there, and you take a competency test, and then you're allowed to feed your mom. No problem at all. And we do have that feeding program, and there were and have been, I don't know if there's any right now, who were part of that program and came in every single day, all 3 meals, and fed the person at the nursing home and did some care. Now, when you do bedside care, whether it be toileting or changing a resident, that would have to be our staff. But feeding, walking a resident, that's fine. We have people that train people to walk as well, where they can ambulate the residents, especially if they have a halfway decent gait, up and down hallways. Yeah, that happens all the time. It's not a problem.
Okay, because there was a question, someone did ask me about that, and I didn't know whether they were able to do that. I know I've seen in as an ombudsman, I've seen people come in and feed their loved ones during meals. But in terms of providing some of that other care, I really would like to see if there's some way, I'd like to advocate for something like that, especially if you're providing training for people to do it so that it addresses the liability issue in terms of.
No, it's permitted, and, people, really love coming in and being with one of the, it's almost Thanksgiving, we have our Thanksgiving meals, with family and resident. They love coming in. I mean, we get so much visitation every single day, and it's just a common practice. And the resident, of course, loves seeing their family all the time.
Yeah.
Thank you so much, Carol.
Yeah.
Thank you. Thank you.
Mr. Graham.
Thank you, Madam Chair.
Did I get it?
Larry,
Yeah, sorry.
thank you, by the way, for hosting us recently. Some of the members went over, it was a great tour. And I was texting you with questions, and you always had an answer, and when I contact you, I appreciate how quickly you get back to me when I'm looking for quantification.
Oh, no problem.
Particularly with the marketing, where there's a direct correlation between our marketing and getting more applicants, but also getting more residents in the building as well. So that's a situation where it works. And I'm a numbers guy. We've gone from 14 million in the red to being in the black, up maybe next year, what you're saying.
It's our goal.
We have an $80 million spanking new building which has fish tanks and pool tables, and you got the state to pay for it. Private pay is up to $500 a day. The residents are up to $240. We're going to have an on-site daycare, which I think you're going to get the state to pay for that too, which is going to be a huge benefit to our employees there, and it's going to help you attract more. Have I got the numbers right?
Yes.
Thank you.
Oh, my pleasure.
Thank you, Madam Chair.
Oh, thank you so much, Mr. Graham.
Great summary, Mr.
That's quantification for you.
So,
Payroll there, Mark.
we want to thank you so much, Mr.
Well, thank
Sack,
you. It's been a
for your
pleasure.
presentation, for the job that you do. Many of us, and not just members, but many people have had to, utilize your services, and we know that, I have to say, I can remember, Frank Senior can tell this story better than anyone on where we have come from as far as moving from one century to the next about this nursing home. And I have to commend Frank for really, because he was one of the people that made this new nursing home happen. For those of you who don't know, Sean can second what I'm talking about right now.
He took a lot of heat for it,
One
too.
vote, right? One vote, wasn't it?
And so I just, I want to thank you for the job that you did.
Thank you.
And Frank, I want to thank you for the work that you put in to make this happen too. And because it was not an easy road to get us there, but you did. So I just want to thank you for that. Thank you so much. Thank you, everyone.
Okay, thank you.
Yes.
I would like to make a motion to close.
Second.
Yeah.
We got 3, 4, 5, 6, 10.
Madam Chair, when's our next meeting? Or tomorrow?
Tomorrow.